People might misunderstand what we try to say. Let's talk about sex, baby. Let's talk about you and me. Let's talk about all the things that make me. Let's talk about sex. Let's talk about sex. Let's talk about sex.
Welcome to the Sexuality Lecture. Sexuality is one of our basic needs. We're all sexual beings, and we express that in a variety of ways throughout our lives and can change throughout our lives. There's physiological, psychological, and cultural factors influence versus sexuality. It's individually expressed and it's very difficult to define. It's very highly personal. It comes from life experiences. It has a huge range of behaviors and attitudes. And there is no normal expression of sex or universal expression of sex. And sexual expression can be defined as to what behaviors give pleasure and satisfaction to those consenting adults involved. Coercion, threat, or injury are not associated with sexual expression. Why is sexuality important to the RN? Because it is crucial to a person's identity. And when they go into a hospital, they don't leave their sexual identity behind. Even in long-term care, they don't leave their sexual identity behind. And sexual expression can change throughout a variety of reasons throughout one's life. Like I said, it's a basic need and it lasts our lifetime. In healthcare, we cannot overlook the need to address the issues of sexuality and its practice. We have a responsibility to provide effective healthcare, including sexual health to the patients that we treat. Sexual health is individual and constantly changing or evolving. And there's a huge range of thoughts, feelings, needs, and desires. Why are people hesitant to discuss sexuality? Embarrassment, anxiety, stress because of misinformation, misconceptions, miscommunications, misunderstandings, and these are dangerous as misses. Sexual healthy people. Sexual health includes freedoms and responsibilities. You should know about your sexuality and sexual behavior. You should be able to express it to its full potential. You need to be able to make autonomous decisions about sex life, meaning on your own. You should be able to experience sexual pleasure. So you can show sexual expression just through communication, touch, emotion, and love. And able to access healthcare for the prevention and treatment of all sexual concerns, problems, and disorders. And you should be able to make free reproductive choices. These are qualities in sexually healthy people. Components of sexual health, this goes along with our self-concept lecture. It's how do you value yourself as a sexual being? What's your ability to contribute to a relationship? The how or why or whom they have chosen to have sex with, and the gender or type of person one is attracted to. Of course, body images influence sexual health to a great degree. It's one central part of one's self-conscious and self-conception. It changes continuously. Life events alter the physical and our image. Things like pregnancy, aging, trauma, disease, cosmetic changes, tattoos, augmentation, reductions of the breasts. So body images definitely influence sexual health. Gender identity, hot topic. And it's one's image of male or female. It's more than just biological. It's more than just with the parts that you were born with. It includes social and cultural norms, as we well know. As I said, it may or may not conform to one's biological sex or anatomy. And it's an expression of what is perceived as gender appropriate behavior. And outward expression or one sense of maleness or femaleness plays into gender identity. So, sexual health promotion. You need to do education on sex, teach responsible sexual behavior, how to prevent STDs, and teaching people about contraception. So as like anything, sexual development happens throughout the lifestyle. In infancy and early childhood, usually you're treated as gender dependent. Your gender identity occurs within the first 3 years. Preschool age children are interested in their own and others' body parts. It's just a natural thing for them to be touching themselves and learning about themselves. And they should learn the correct names for body parts. I have to tell you a funny story. When we were kids, I had 5 brothers, and our parents, you know, they grew up in the 50s. So they told us that, you know, they called penises schnitzels, and they called vaginas turkeys. Don't ask me why. It's just what they were called. I remember my brother flipping out one time. We were in a German restaurant, and they had Wiener Schnitzel on the menu, and he got hysterical. So it's just important to learn the correct body names for body parts. Just tell them. It'll be less embarrassing for them to say it, and it's just a normal vernacular for these important body parts. School-age children, they usually have a strong identification with the same-sex parent. They like privacy. They may have concerns, questions about sexuality and reproduction, and they need to know what to expect as they approach puberty. For example, a girl needs to know at some point in her school-age years that she's going to get a period and what it means, instead of just showing up and flipping out because she had no idea that this was going to happen to her. So in puberty and adolescence, like I said, they need accurate information about body changes. Of course, menstruation begins. There's a lot of peer pressure and influences during puberty and adolescence. And it's important to provide accurate, factual information about sexual activity, intimate relationships, STDs, pregnancies, prevention, protection practices. Young adults, they start to explore and define emotions, their intimacy, communications, and sexuality in relationships. They start to learn techniques that satisfy themselves and their partners. But yet they still continue to require information. As we move into middle adulthood, we start to get concerned about our physical appearance and make us think that, you know, we're less attractive. Like I said, beauty's in the eye of the beholder. Then you get the male and female hormone changes. Yes, male have hormonal changes. Their testosterone goes down as we get older. And female hormone changes are pretty well known, you know, the menopause changes. And in older adults, they have the physical changes, but yet they're still interested in sexual activity depending on their health. And there's also concerns about privacy depending on their living circumstances. Factors that influence sexuality. Culture, first of all. Individual cultures have different influences and regulations. Some cultures expect certain role behaviors. There are definitely some cultures who have rules about premature sex. And for us, we must be culturally aware and sensitive to our patients' cultural influences. Gender effects are influencing sexuality. Education, how much do we know about contraception and STDs? Your socioeconomic status plays into it. And religious value, which kind of go along with cultural values. They can influence and impact sexual expression and health. And sometimes they provide guidelines for sexual behavior. Some more factors, your own personal expectation of ethics. We all have our own personal ethics code about our sexual behavior. Important note, we must not, as RNs, impose personal, religious, or ethical practices on patients. And that is very important. You can't judge another person. Family, that's the earliest, most enduring social relationship. We learn behaviors for gender roles and expectations for ourselves and from others from family, which sometimes causes conflict. Medication, illness, disease. Chronic diseases and medications can affect sexual functions for both males and females. Diabetes, heart disease, joint disease, mental disorders can all affect a person's sexuality. And of course, there's medications that are now available to treat sexual dysfunction. Ironically, they're mostly for men, Cialis or Viagra. I think there is one woman's medication out there. I don't know the name of it, but obviously in a paternal society, our medications are geared more towards men at this point in time. Hopefully that'll change. So we have to take a sexual history on our patients if it's pertinent. And we need to analyze our own personal values so we know how to provide quality care. And everything's not universal. So you gotta let your own stuff go and just go with the flow. So the amount of time and data collected depends on context assessment. So who should have a sexual history assessment? Anybody receiving care for pregnancy, contraception, infertility, STD testing, and treatment. Those who with illnesses on medication or disease that may affect sexual functions, and those with sexual problems. So we don't do sexual histories on everybody. So all the nursing history should include questions regarding changes in sexual functioning. What are some of the ways to introduce this topic? You can read the examples below. You ask about their medication, you ask about their chronic illnesses, anything unhappy about your sexuality. You have to ask about their genitals, whether there's changes or things like that. A good nursing history, sexual nursing history includes all of these bullet points. So you see this is bolded. It's critical for the nurse to present the sensitive topic in a calm, professional manner. This is why we use therapeutic communication. It allows the patient to adequate time, privacy, and comfort to answer. Again, we must be non-judgmental. We must ask questions and review symptoms. Start with a more general question first. So let patient know that some people complain about do not lead or speak for the patient. Ask, has anyone ever spoken to you about? And then you fill in the blank. And you encourage patients to discuss issues or concerns regarding sexuality. How do we do this? The PLISSIT, implicit intervention model, is the way that one way that we can do this, and it's a very good way. The P stands for permission giving. So the patient needs permission or validation for their thoughts and feelings. So by giving permission, it lets the patient know that their thoughts, feelings, behaviors, and fantasies among consenting adults is totally allowed and is valid. Ally is limited information. So the patient needs accurate and concise information. Explain what is considered normal. Like I said, there is no normal unless you're dealing with an abusive relationship or non-consenting adults or something that would harm a person. So let them let their guard down. So specific suggestions. When we come to this part, the nurse requires specialized knowledge and skills at this level. This is like, your therapists and things like that. Not every RN has specialized knowledge on sexuality. The nurse may offer alternative methods of sexual expression or suggestions to promote optional functioning. Again, this requires specialized knowledge. And intensive therapy, the IT of it. So if it's ineffective, your counseling, you need an expert. You need to get an expert to help this person. It may involve issues of sexual motivation, marriage, or mostly self-concept. Sometimes we have to deal with inappropriate sexual behaviors by patients. Know your own views. Be comfortable discussing sex. You need to know how to identify inappropriate behavior and be familiar with the boundaries and limit settings with your patients. Here's a list of inappropriate sexual behavior that happens. Sometimes it happens with the dementia patients. They get very sexual, and it's just a list of different things and strategies on how to approach a patient who's inappropriate in a sexual way. And you're allowed to say, don't do that. And you should report when patients are acting in an inappropriate sexual way. There's a video on Blackboard called Inappropriate Behavior with Dementia Patients. It's good. It's a good video to watch involving dementia patients who are sexual. So make sure you watch it on Blackboard. Nursing diagnosis, ineffective sexual patterns. Look this up in Ackley and understand, some of the interventions that you may be able to do to help this. That's all for sex right now. I'm going to put up another video, which is talking about transgender and all the different aspects of sexuality that we currently are going through these days. Thanks, and I hope you are well. Take care of yourselves. Bye.